Hello, everybody. Welcome back to another presentation in the Quality Improvement Program. This is the last one in the series. This one today we're going to be covering is the 715 Health and Wellness Check. We've broken this up into two parts, only because it's such a big presentation and there's a lot to cover. So today I'll be presenting part one and Karen will be doing part two. And like I've said before in other presentations, I will be turning this screen off that you can see my face on, just so it doesn't obstruct any information that you need to read or see. So welcome back to another presentation. I hope you enjoy this one. Hope you got a cuppa, and let's get to it. I want to take this moment to do an acknowledgement and give my deepest respects to all the First Nations mobs and all the lands we meet, sit and live on today. I'm tuning in from beautiful Wabakal to Wabba country, and I commemorate and honour the elders for their strength and resilience. I congratulate and appreciate all the hard work our present brothers and sisters, aunties and uncles are doing to encourage and empower us to stay true and be deadly. And lastly, I want to express my admiration and respect for the journey of our youth today, who will not only be our future leaders, but will keep alive our memories and our beautiful stories. So the learning outcomes for today is what a 715 health check is, checking a patient's eligibility and using HPOS or PRODA account, understanding the components of an effective health check, who can perform the health check, and improve awareness of the importance of these early interventions and screenings, preventative healthcare tools. So what is the 715 health check? Well, why you read the dot points on the screen there? The aim of these health assessments is just to encourage mob into communities to receive the primary health care that they need. It identifies and encourages early intervention and find those treatable conditions early, but also find any other hidden ones that they may not know about, and to give them the right care. And it just gives them that baseline, and they know about that baseline too through these assessments, and that way they can be in more control and they actually know what they need to keep an eye on. But also it gives you as the practitioners a good baseline for them to start and encourage them on their health journey. So the purpose of these 715 health checks is to support initial and ongoing engagement in the comprehensive primary healthcare setting, but most importantly, it needs to be culturally safe when mob come in to see you. That's very important because they might not come back after the first one. So initiating that first, health setting in a culturally safe way, you'll get those patients coming back ongoing, and then that provides that evidence-based health information. You take your risk checks and other services for primary and secondary disease preventions. Identify the health needs, including the patient's goal and their priorities. And then I guess also very important is supporting participation in population health programs, immunization, cancer screening, for example, chronic disease management. We've gone over that with the ITC, and other primary care services, example, oral health, and all this plays a part. Every other presentation we've done, it all feeds into this one. These health checks allow access for health professionals in the general setting or community health service setting, just give them the comprehensive healthcare that they need. It identifies and it can just do those follow-ups and monitoring services or treatment that are required to improve the patient's health journey. They've been physical, mental, or a social setting that could be interrupting their lifestyle as well, or their health choices. These health checks can identify issues across their lifespan, can create better outcomes, preventable measures, identifying those maybe a chronic disease they didn't know, and then helping them manage that. Early intervention, which is a big one I like, and this all feeds in from that Closing the Gap initiative. These health checks must include information collection, including taking a patient and family's history and undertaking examinations and investigations as required, making an overall check of the patient, recommending appropriate interventions and investigations and management, providing advice and information to the patient, keeping a record of the health check and offering the patient a copy of the report and recommendations about their health needs. This is very important. If you can remember this one, please, this one is very important. It just gives them something visual to see. Sometimes I've heard a lot of stories that a lot of mob leave a health check and they don't get this a copy of the report when after the assessment's done. And offering a patient's care, so if there are any medical practitioners considering it appropriate and the patient agrees, a copy of the report, extracts of the report relevant to the carer. So it's just most time you might get a patient coming with another relative because it's that's how sometimes the homes work. You have a lot of family members in the home, and sometimes they just like to have someone there present with them because they don't understand the health literacy sometimes, and having someone there to second set of ears. And then maybe if you can just give that copy of that, like I just said in the last dot point, to that carer or to the relative that comes into the health assessment with your patient, that'd be greatly appreciated because it's a big one. Like I just said, it's sometimes they just like to know what was all about today in the health assessment. And sometimes there's a lot to remember in these appointments because there's such a big health assessment. So yeah, the record just gives it again another angle of helping them understand what happened today in that assessment. Connecting with your patient. This one's probably a big one, especially if you've got a new patient coming to your practice and they're coming in for a brand new 715 health check, or they're never had done one before. Again, it's easy to say as practitioners, you always want the best for your patients, but there's a lot of stigma around mob coming into practices and they just don't like it. Like there's lots of past traumas and intergenerational just feelings there around this. So if you, without reading everything off that screen there right now, if I can just give this to you, if you can just go into this appointment as a practitioner and treat your patient just as like take all that, just put the human element to it. I know you got to be a practitioner. I know you got to ask your questions and do your health checks in a certain way, but if you can start it off just by having that human element and just being relatable, because at the end of the day, we are still human beings. We all have things in common. So that's probably the best way I can probably put on this slide, because without reading all that, it's once you develop that trust and that's the baseline for you then for the rest of the appointment and assessments, it flows in and this patient will go back to their community and talk about your practice, and it just has a flow-on effect. And that's all you want. The more trust you have as at your place of business, that's when you're going to get better, I guess, data for doing these health assessments. So to be eligible for these health checks, because they're all got different categories because of the age groups, but the following age groups are here, as you can see on the screen. So from children from a bubba to age 5, children from 5 to 12, then 12 to 24, age to 24 to 49, then 50 and over. So they're the 5 different brackets. They used to be only, I think early days it used to be 3, and then went to 4, but now they've opened right up now to 5. To provide a 715 health check, you must be eligible practitioner or a registered practitioner working in that practice. You must also personally attend to the patient on each health assessment. You cannot be a specialist or a consultant physician. When you provide items, you must do all the following. So take the patient's and family history, perform or request any investigations as required. Keep a copy of the health check on the patient's file, please. Recommend appropriate interventions and follow-up care services. Overall assessment of the patient. Provide the patient with their care, a copy of the health assessment and a follow-up plan, please. So nurses can collect information, including gathering patients' health history and taking and recording routine measurements, providing a patient with information about recommended interventions at your detection. These activities must be performed in accordance with an accepted medical practice and under your medical practitioner's supervision. So, for example, a practice nurse is in this assessment and there's health worker, Aboriginal health worker, or another practitioner that is being used to assist with the health check. And they could be just there collecting information and providing information to the patient. Well, as the lead nurse or lead practitioner nurse, you must be satisfied with their suitable qualifications and have the necessary skills and expertise and training to perform those tasks. All other components of the health check must include your personal attendance. So a joint venture between the RACGP and NACHOS with these new templates in the 715 health checks, the components that they're going to cover. And we will later in this presentation just go over a few of these questions and how they look and how it flows. But these are, as you can see on the screen, this is what they cover. So you have current health, just your medical history, medications, gambling, sexual health, mood, examination, screenings that could be, for cancer, cardiovascular, circulation, eye health, ear health, social and emotional well-being, physical activity. As you can see there in the physical activity, if I've lost you, I'm sorry, but under physical activity, there is the screen time too. So that's been added in there. So, but as you can see, it covers a lot. It's very in depth, but like I said, later in the presentation, we'll go through some of these questions and how it looks in the component, but this is just to show you in these new templates what it's going to cover. So these new templates, the joint venture of RACGP and NACHOS, they cover those 5 components in the eligibility. I've covered that in the slide before with the ages. But as you can see on the screen there, it's infants and preschools, primary schools, adolescents and young people, adults, and then our elders. These templates are not intended to promote a tick and flick approach to healthcare, but rather to promote clinicians to consider patients' priorities, give them opportunities for preventative healthcare and common health needs. You just see, like, there's an example here from the age 25 to 49 years template for men and women. So obviously, as you can see, it breaks it down there. And a lot of you probably might have seen the newer ones. If not, this is what it looks like. As you can see, it's quite in depth. There's lots of information. I guess if you're doing a first health assessment, it's covering a lot. You're getting a lot of data of that patient, which is really good. So yeah, hopefully as the practitioners, hopefully this is a bit more simpler and more direct for what to do and how to follow the format. So some example questions that will happen from these templates, these new health checks. You see the top left-hand side there, it goes to regular medications, and over to the right, allergies, then your family history, then physical activity. I think just not to read all that, what's on the screen, but if you build that relationship at the start of the assessment, especially if they're a new patient coming to you and they're just first time doing a health assessment, especially if like a teenager, young boy or girl, if you build that relationship at the start, getting all these questions will become easy once you get to them, because I think that trust will be already built, and letting them know too that all this information they share with you it's private and confidential, which is also another big thing that they've building that trust. So these are some examples of questions that you'll ask, and obviously the one down the bottom right, what do you do for exercise? How often do you exercise? Like, they're quite a lot of questions, but they're all relevant for the health assessment. And you go into the other ones there. I guess like look at the medication ones, what they're asking. But these are all stuff that you probably ask anyway as you go along, if you've all done a lot of these health assessments before. But if not, you haven't done one of these, this is what these questions cover and how in depth they get. So yeah, good luck. Just flowing on from the last slide, these are some more example questions from the brand new templates, all around social and emotional well-being, gambling, and alcohol and substance abuse. And obviously the tobacco one's a separate one on its own. So yeah, and obviously from those questions, there's a lot of flow on effect when you add in the details. And then just another examples of showing you some questions from the brand new templates, sexual health and eating. Again, like you see, there's lots of areas that it covers, but when you go to the details, it'll flow into, I guess, more of how the question is answered by the patient. I was just sitting out in a bit of laughter myself about the eating one, healthy eating one there, which is food. There's like a lot of the takeaway, KFC and Macca's. There'll be a bit of a struggle there, but anyway, it's good to see that's all included in there. But yeah, as you can see, most of these slides that we're going to be doing now are just showing you example questions as we go along. Again, this is another flow on from all the other ones, but yeah, this is some more questions that are in the brand new templates. I just won't talk too long, but I might let it just flow. There you can see there's lots of, as it flows down, with the school one here, the learning and work. Especially if you've got young men and women coming to you, adolescents, you got school and your friends, and you like school, to get along with the education officer there that supports you, how's work, do you like what you do, colleagues, home and family, so I'll just let this sit on the screen for a little so you can see it. I mean, you obviously don't have to ask word for word these questions, but yeah, it's a good indicator of where the question and the information will flow once you ask these. Another one's with this more questions from the brand new template here in health. I'm in mood, so I'll just leave this up without me talking to it, so you can just see if you want to talk to those questions or add those to your arsenal when you're doing these health assessments. We've only got a few more of these slides that come with all these questions, but again, here's some more new questions from the new templates. Health check. So this is oral and dental health, immunization, and eye health. So this is the last page of all those example questions that we've been going through. Hopefully it all looks okay to you. If you're already doing these health assessments, hopefully these questions or this form looks a lot easier to use and a lot straightforward. I do hope if you're new to doing health assessments, I hope it's looks not so daunting and quite straightforward. And when you're doing these health assessments, I know I've already said this, but I think if you're doing the yarns at the start of your health assessments and building that relationship with your patient, you're going to get all this information quite easy. And just remember that the patient's coming to you with a lot of their, I guess, family issues around like trusting institutions and also that private and confidentiality thing, because they might not have got it at other practices or Aboriginal medical services. So again, if they're new to your practice and you're building this together, yeah, it'd be really, I guess be great if you just took that time at the start just to have that bit of a relatable yarn with them, because again, like I said, once you get to these questions, it'll just be a lot easier. You'll get a lot out of them, and yeah, you're gonna have a patient for life really, and they'll be an advocate for you too when they go back to the community, because they'll talk about your practice, and then you'll have a lot more of the mob coming to your door to want to book in. So hopefully your books are still open, because once you do right by a couple, they're all going to come. So, but yeah. Just on the screen right now is a photo of the National Guide of the Preventive Healthcare for Melbourne Community. This is a new edition. This was added by Bree Foley at the start of this program when we were getting going. So this is up to date. And as a team, we thought this would be really good for you to have as just another guide as you're going through these health assessments with your First Nations patients in your practice. And just some more resources for you to refer to or just lean on whenever you I guess need to. This in this page, as you can see, we have lots of resources for you to follow or to lean on or to just reach out. So community health pathways is a really big one, and patient info, a lot of you might know. In the middle and the bottom there, that's the First Nations health page at our website that just goes all around health and wellness checks. And they're probably a resource to give out to your patients as well. Showed you the guide up there on the right, top right. You go along the strong mob, staying deadly and living longer. So these are all through the PHN telehealth guide and a health guide. And so I guess it's just a drop-down box of the flow and effect of how it all goes. All the information today that I'll be referring to in this part one of the 715 health checks, this is all the links that and information that I've been talking about and extracting it from. And as you can see there on the last link there, that's the preventative health check for First Nations people. Maybe if you click on that link, I'm pretty sure anyone, the team of the PHN can link you up with a copy of that for your practice. And this is just a screenshot of our website. If you need some more resources for your practice, fact sheets, or you want to watch all these presentations again, all these videos are available on our website. And if you need anything else that we don't have, we can always source it. We're happy to help in any way we can. But as you can see there on the left, the link is already there if you'd like to click on it. Or if not, this is what you're looking at when you go to our website. As you see myself there with my family. After today's session, it'd be really great if you can fill out the surveys that Karen sends out for these presentations. For this one today in the part one of the 715 health check, be greatly appreciated if you can just give us some feedback on how we've delivered it, if we've done it right. So any feedback, doesn't matter good and bad, helps us to improve. So you, the practices, nurses, and then staff at the GPs can get everything that you need and want to know from us. So please take the time to fill it out after today's session. Just another thing I want to share too right now is usually we share a video in through our presentations, but this one won't play. But this is a case study interview with Dr. Mark Weathertong. I'm not too sure if any of you might know him, but he's a well-renowned and well-respected Indigenous man in the communities. And he works not only with Aboriginal people, but he works with Torres Strait Islander people too. So he's got a vast amount of knowledge, and he's worked in remotely and urban settings as well. So he does have a lot of wealth of knowledge. But this little video we can't play here right now. It won't work. But we're going to put the link in at the end of this presentation. So if you want to watch it, it's a good insight into how he sees and how he conducts his 715 health checks. And it's not a long one, but I think it's a lot of golden, lot of Easter eggs in it, golden Easter eggs for everyone. So if you do watch it, enjoy. And that brings us to the end of our presentation today for the part one of the 715 health and wellness checks. I do hope you got a lot out of it today. I want to thank you for tuning in to all these presentations. They mean a lot to us. We love delivering them. So again, thank you for tuning in, and we'll see you on the next one. Hello.